A commission of inquiry overwhelms the French government for its management of the crisis. A parliamentary commission of inquiry denounced Wednesday a faulty management of the crisis of COVID-19 by the French government, after 6 months of hearings on the management of this epidemic, which has made more than 53,000 dead in the country. The presidential party LREM immediately denounced a partial report by this commission of inquiry of the National Assembly, led by the right-wing opposition. France was poorly armed in the face of the pandemic which broke out at the beginning of the year, affirms the leader of deputies LR, Damien Abad. The management of the crisis was chaotic and revealed structural flaws, added to the press Eric Ciotti, LR rapporteur of the Commission of Inquiry. The Committee of Inquiry adopted this report on Wednesday morning, which points to a series of failings by the public authorities upstream of the health crisis and during, but without the votes of LREM deputies who abstained. All the other members are in favor. The report must be officially made public in 5 days, time to collect the observations of the political groups. In total, the Commission of Inquiry conducted more than 50 hearings, including that of former Prime Minister Edouard Philippe and several successive health ministers, lasting some 130 hours in total. The Commission of Inquiry was neither a people's tribunal nor a judicial tribunal, and there is no personal questioning, assures its rapporteur Eric Ciotti. Since the start of the coronavirus epidemic, the executive has been the target of numerous complaints for endangering the lives of others or manslaughter. A total of 96 complaints against ministers were lodged with the Court of Justice of the Republic, which alone has the power to judge acts committed by members of the government in the exercise of their functions. France is fourth most affected countries in Europe, notes Mr. Ciotti. Some countries have coped better than others, he insists, with supporting figures. The average in the European Union was 532 deaths per 1 million inhabitants, and the average in France reached 727 deaths. We see a lack of anticipation and an underestimation of the epidemic risk, a decline in strategic stocks, with supplier problems not sufficiently diversified, listed Damien Abad, founding French policy which dates back to the 5-year term's previous ones. It recalled during the crisis the contradictory messages on masks, failures in the testing policy, and even the great forgotten that were the retirement homes and patients outside COVID. And exclaimed, "Never again."